Tell me about prevention. You said prevention is the key. What do you mean by that?
So cardiovascular disease or heart disease is a very complex disease process. There's just not one thing or one condition that causes heart disease. So there are multiple risk factors for heart disease, and we like to identify those risk factors and modify those risk factors so that we can prevent the development of heart disease.
So what are some of the risk factors that people have? And you said so we can modify it. How do you break down risk factors?
Right. So I like to talk about the risk factors you can control, those modifiable risk factors versus the ones that you cannot control. So the risk factors that you can control, so knowing your numbers, we always talk about knowing your numbers. So high blood pressure, high cholesterol, diabetes, your body mass index, whether or not you smoke. Those are really the 5 big ones that you can focus on, that you can control, that you can modify.
So how does the blood pressure lead to a heart attack, and how can you prevent it? What are the important parts of controlling blood pressure?
So blood pressure is a very complex problem, and when the systemic blood pressure is high for long periods of time, the heart has to pump against that blood pressure, and the heart can remodel and can remodel itself to control that blood pressure, and sometimes that remodeling process can change the arteries and lead to blockage formation.
Cholesterol, what does it do?
Well, cholesterol, you have cholesterol that you eat and cholesterol that your liver manages, and for the most part, cholesterol leads to the actual blockage or plaque formation inside of the arteries.
So we can control your cholesterol by?
Cholesterol, you can control it by eating heart-healthy foods low in animal saturated fats. Unfortunately, you can only manage that about 10% through diet alone, and a lot of people need medication, the statin classes of medications, to lower their cholesterol.
So we've got blood pressure and we've got high cholesterol, or some of the others?
So diabetes, patients at risk for diabetes, meaning that they do not metabolize sugars or glucose appropriately, and they may be a type 1 diabetic, maybe they're born with diabetes, or maybe they're a type 2 diabetic and they develop it as an adult. So knowing your risk for diabetes, knowing your sugar is very important.
I had somebody tell me once that diabetes is a wake-up call. If you've got type 2 diabetes, you really need to get to work on that part so that you'll stay healthy and won't have heart disease.
Right. A lot of us cardiologists still think that diabetes is a heart disease equivalent, meaning that if you have diabetes, your risk of having a heart attack is almost the same as someone that's already been diagnosed with heart disease. Diabetes leads to so many health problems, including heart disease, kidney problems, strokes, peripheral arterial disease, so it's a very important diagnosis to be aware of.
Smoking?
Smoking. There's not a Smoking is bad for so many reasons, but the tobacco is very irritating to the lining of blood vessels and can contribute to blockage or plaque formation, and can irritate any blockage that you have and cause a heart attack to happen. So any tobacco or nicotine containing product is very damaging to your arteries.
How do you tell people to stop smoking?
I tell people they have to make it up in their mind that they're going to be committed to quitting smoking. They have to commit and want to quit smoking for it really to happen. So it's very much a mental decision.
The people that I've seen the most effective in stopping smoking is saying, okay, I'm quitting. You know, but it's a very addictive thing. It's very, very difficult on somebody. So we as physicians have to keep on people with that. Sedentary lifestyle, what does that mean?
Inactivity, not getting regular aerobic exercise. So most Americans are sedentary, meaning that they don't meet the goals that the American Heart Association sets for exercise, which is 150 minutes a week of moderate intensity exercise, so 30 minutes 5 days a week of walking, or 75 minutes a week of intense exercise like running. But most Americans do not meet those guidelines for aerobic activity. And exercise has many health benefits. It lowers blood pressure naturally. It can help lower cholesterol. It can lower your blood sugar levels. In addition, it conditions your heart so that maybe it tolerates heart attacks better or heart disease better, and can even prevent it.
So 150 minutes, that's like 30 minutes, 5 days a week. What do you think about some of the technology, the Fitbit watches, or the watches that help encourage people to be active every day?
I think it's good to know how many steps you're taking and to know that you have been active throughout the day. But really, from a cardiovascular perspective, we want you to get dedicated aerobic activity. So 30 minutes a day of sustained aerobic activity, keeping your heart rate at an elevated level for 30 minutes a day is actually what's more beneficial.
So you have to walk fast or you have to walk?
Walk with some, you know,
Some vim and vigor to it.
Some intention.
Don't
yes.
gaze and stop and look at the flowers.
Right.
But any type of activity is better than no activity.
Exactly.
What are some of the activities that the cardiologist likes?
We like aerobic activity, so walking, jogging, anything that will get your heart rate up to condition your heart.
What about bicycle riding? Is that good?
Cycling is very good, and it's actually very easy on your joints, so cycling is very good as well.
I know there's a guy, Kenneth Cooper was the first one to use the word aerobics, and he could tell what somebody's conditioning was going to be until one person stumped him. That was a person that he didn't recognize was riding his bicycle to work and back. And he was physically fit as anybody that was in there. So exercise is very important. Get off the couch, get your tennis shoes, get with it, make it sustained activity.
Yes.
That's a very important facet.